Prescription drug abuse is being called a national public health epidemic, and our area is not immune. 1 in 6 La Crosse County high school students have used a prescription drug without a doctor's prescription. That number jumps to almost 1 in 4 students when you look at just high school seniors. These statistics are part of the most recent La Crosse County Youth Risk Behavior Survey conducted by the La Crosse County Prevention Network. The LCPN is a coalition which focuses on the prevention of youth substance abuse. They found that a growing number of La Crosse County teens are abusing ADHD drugs like Adderall or Ritalin or prescription painkillers. Lisa is here now with a look at this growing trend in a News 8 investigative report, Prescription for Problems.
Mike, the results of the survey were not a surprise to the coalition. They have found that part of the reason for the increase in abuse is that prescription drugs are easy access for high school students, with painkillers like Vicodin and OxyContin being the most widely abused nationwide. And many times the drugs are coming straight from our medicine cabinets.
This is where we keep them, in here.
Nancy and Robert Jacobs of Onalaska have a medicine cabinet that looks like many people's their age.
Being elderly, obviously we have, blood pressure drugs, and we have cholesterol drugs, and we also have painkillers.
While the Jacobs have these drugs for medical purposes, some teens in La Crosse County are stealing prescription drugs like painkillers for a very different reason.
They're using them just to obtain the high.
Yes.
Onalaska Patrol Sergeant Jason Job is a member of the La Crosse County Prevention Network. According to the coalition, 70% of people 12 and older who abuse prescription drugs get them from family or friends.
There's an easy access to these prescription drugs. It can be in your parents' medicine cabinet. It can be in a friend's medicine cabinet, at a house, grandparents.
I like that one best.
The Jacobs are raising their teenage grandson right now and were alarmed when they heard about this growing trend.
He has a steady stream of kids coming in and out of the house, 18, 17, 16-year-old kids.
While they don't worry their grandchild is abusing prescription drugs, this is a common scenario for how teens get access to prescriptions that don't belong to them.
Most people, when you use the bathroom, you shut the door, so you have privacy to do whatever you want to do in there.
Wherever they're at, they can just take them without maybe them even noticing. If they take 1 or 2, over a period of time, is someone going to miss that?
For that reason, the Jacobs family cleaned out their medicine cabinet to prevent themselves from possibly contributing to this problem.
When the prescription bottle has your name on it, you need to be careful with that drug.
Now, the LCPN also says a major issue with prescription drug abuse is that teens do not view prescription drugs as harmful because, of course, they are prescribed by a doctor. We'll take a closer look at this issue tomorrow in part 2 of our investigative series, Prescription for Problems.
As a parent, they're very surprising statistics.
Shocking.